support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darabite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darabite from LB Pharma. Darabite, love yourself.
Autoimmune diseases are conditions in which the body's immune system mistakenly damages healthy cells in the body, or it results when the immune system is overactive, causing it to attack and damage the body's own tissues. Normally, the immune system creates proteins called antibodies that work to protect the body against harmful substances such as viruses, cancer cells, and toxins. But with autoimmune disorders, the immune system can't tell the difference between invaders and healthy cells. The exact causes of autoimmune diseases are unknown, but scientists have some theories on what triggers them. While there aren't any cures for autoimmune diseases yet, there are many kinds of treatment that help control the immune system response and manage the symptoms. Today on your favorite health talk show, The Physicians, we'll be talking about autoimmune diseases. Do stay tuned. Another day on your favorite health talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and of course, I'm always here with my co-anchor, and she's no other person than
Dr. Martina Agberia. Welcome to The Physicians, where your health is our business.
Where were you? When I called your name, you were like...
Yes, because I needed to express myself with excitement that I'm feeling right now.
It's good to be excited because at every point in time you wake up, you're always saying, what will today bring? And if you are grateful, things will fall into place. When there's life,
there is always hope. And nobody can actually make you happy except yourself.
It has to come from you.
Yeah.
Before any other thing. Because any other thing coming can make you happier.
You actually have to be deliberate.
And intentional.
Yeah.
Today we are talking about autoimmune diseases.
Autoimmune diseases. Oh, Dr. May. Each time I hear autoimmune diseases, you know what? I always wonder why will something that is in me decide to now fight?
See why we started with happiness.
Some people will tell you something that is within you fighting you. There's a problem.
Yeah, you are the cause.
So we say explanation.
Village people.
Yes.
You have offended someone.
How can something that is within you fight you? Is reacting.
And that's why the doctors are here to let you know, enlighten us. And I'm very happy with the consultant taking this topic because he knows his onions and he will help school all of us what autoimmune disease is.
Whenever I remember auto, I remember this doctor.
That's it. Forget it. We'll be right back after this timer. Do stay tuned.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darabite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darabite from LB Pharma. Darabite, love yourself.
Welcome back. If you are just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. With us in the studio today is an amazing man who is changing the narratives when it comes to autoimmune diseases, when it comes to rheumatology, not only in Lagos, but in Nigeria and, of course, Africa at large. He's no other person than Dr. Hamid OLAOSEBIKAN, who is a consultant rheumatologist with Lagos State University Teaching Hospital. Sir, you're welcome once again to this show, and we are really, really honored.
Yeah, thank you for inviting me today. It's a pleasure being here.
Yeah, thank you very much, sir. I want to quickly dive right into the program. What are autoimmune diseases?
Well, thank you so much. Autoimmune diseases, autoimmune is a Latin word, which auto means self, immune system, something, immune system. Everybody, colloquially means something that helps to, protect our body against developing diseases. So when normally all the creatures of God, we have immune system, and what immune system does is to fight germs, to safeguard our body against diseases, to protect our body against infections or germs. But sometimes immune system can be defective, in the sense that it can either be too weak or too strong. When immune system is too weak, it means that it cannot even respond to infection or to invaders or to an organism or germs. And when it is too strong, it can now go later to attack the body. Now in HIV/AIDS that everybody knows, the immune system is weak. So ordinary infection that the body should be able to curtail, the body succumbs to that infection. But in autoimmune disease, what happens is that the body has this inability to distinguish between what is normal part of the body and what is abnormal part of the body. The basic unit of our body is called cells. Cells is like, you have a building, you have a block. A block is made up of cement and some other things. So the basic unit of our body is cells. And we have our body is made of normal cells. But sometimes abnormal cells can enter our body via infection, via cancers and everything. So our immune system is supposed to curtail abnormal cells via infection or via cancers. But in autoimmune disease, the body is unable to distinguish between abnormal cells or normal part of the body and abnormal invader, which is infections or cancer cells. And the body now go in turn to, the immune system now start to attack the body. In that attack, the immune system, the body wants to also respond to that attack by repelling that attack. So there's what is called ruffle fight between the body and the immune system, leading to inflammation in that part of the body that is being attacked. Now, autoimmune disease can attack just a isolated part of the body while sparing other parts. For example, autoimmune disease can just attack the pancreas, and that can lead to diabetes. So, a type of diabetes called type 1 diabetes is an autoimmune disease. But there are other types of diabetes that are not autoimmune based. An autoimmune immune system can just attack the skin and lead to whitening of part of the body called vitiligo. So that is an autoimmune attack on the melanocytes, which is the cells that cause skin pigmentation. Yeah. So, and sometimes autoimmune can just attack the joints, as well as rheumatoid arthritis. Or autoimmune simultaneously attack multiple parts of the body at the same time. So you have in lupus, or Sjogren and other connective tissue diseases, where you have simultaneous attack or sequential attack of multiple parts of the body at the same time. Why do we have this attack? Specific reason is not yet known. But we know there are certain factors, or what is called risk factors, that increase this risk or tendency to develop autoimmune diseases. And those risk factors are basically divided into two types: the genetic factors and the environmental factors. So specific reason for autoimmune disease is not known, but there are certain factors. So what are genetic factors? Genetic factors are the proteins, are disease-causing proteins that we inherited from our parents. Our parents themselves may not have that disease, but they may have the gene, which can be suppressive in them or not activated. So by virtue of giving birth to us, we transfer the gene innocently to us. So if, for example, my mother transferred lupus gene to me, the lupus gene may not be active in me, but when my dad gene encounter an appropriate environmental factors, there will not be interaction between that environmental factor and the genetic factor to stimulate our immune system to go into overdrive. And that's what happened. Now, what are these environmental factors? There are so many. One of them is exposure to toxins. Toxins like poisonings. Let's use poison or toxins in our environment, from air pollutants, the water pollutants, or even something we inhale unknowingly, maybe from toxic active smoking, or even passive smoking, fumes, and all this that we don't have power over. All this can interact with our genes. Sometimes infections that we have had in the past can lead to release of something we call antigens that can interact with the antibody and stimulate our immune system to go into overdrive. So infections too can cause autoimmune disease later. not immediately, but as a sequelae or complication of infection you have had. Recently, we have a lot of patients that survive COVID that are now developing autoimmune disease 2 years, 3 years after COVID-19 because of the COVID. Yes, COVID has stimulated the immune system to go into overdrive, and that is what happened in some other previous infection that people have had in the past. So we have a resurgence of autoimmune disease because of advent of COVID. And not only COVID-19, there are other infections like Epstein-Barr virus infection, mumps virus, Coxsackie virus, all these viral infections. There is a link between them and an eventual development of autoimmune disease later after surviving the infection.
Who are those people that are more, likely to have this autoimmune disease?
I want to join my
Please join me.
Yes.
Don't call female. I will end this show now.
HAKEEM. I want to join myself. Where's the lack of?
Yes, it shouldn't
But
be.
it's obvious that it's going to burst our bubble. But anyway, right down.
Well, as we have, as cardiovascular diseases are more common in male,
See the angle you are coming from
the
now.
autoimmune diseases, unfortunately, are more common in female.
Let us
It's
close
okay,
it.
no problem.
Let us end the show.
Yes, but the irony of it is that if male has an autoimmune disease, it's usually more severe, more aggressive
than the.
more
Why is that so?
life-threatening
Why is that so,
than
sir?
female. Well, the reason is that males, apart from that, males generally we do not present early.
Okay.
When we have any diseases, and there are also some genetic reasons why there is a genetic difference that determine disease outcome compared to female. So there are some leader genes that can confer poor outcome compared to female.
Okay.
Yeah. So it's commoner in females. 2, Hispanic and Americans, African Americans, and by extension to us, the native black Africans, we have autoimmune. Some autoimmunities are more common among us, like lupus is more common. Then there are some the disease called vasculitis, an autoimmune disease that when the autoimmune affect the blood vessels. Okay. Those ones are more common among the Caucasians, the whites. Like all these the big name now, short-stroke syndrome. I don't want to because those ones are more common among the Caucasians. So it depends on the race and also on some autoimmunities are more common in hot climates than tropical winter climate, something like so. So we can't really say. For example, in Nigeria now, the most common the systemic autoimmunity that we see is rheumatoid arthritis, followed by lupus. Yes, but for single organs, I think diabetes is more.
Still leads.
Yes, diabetes is more common than rheumatoid. And autoimmune condition can also overlap. They can have 2 or more autoimmune diseases occurring in one person. If a person has vitiligo, you have to screen for type 1 diabetes. You have to screen for grave disease because thyroid disease is also an autoimmune disease. Yes. Autoimmune attack on the thyroid glands. So if a person has rheumatoid arthritis, you have to screen for thyroid disease because they all occur in clusters. They all overlap. They are like syndromes. So if you don't look for one and you assume that it's not there, it might be that one that will cause more problem later. They can overlap, and it's more common in female. Why is it more common in female? They found out that women has estrogen hormones, which is more common in male, less common in female, male. That estrogen has been found to be immunogenic. It tends to induce our immune system. That is one reason why female they have more autoimmune disease than male. 2, if you remember our basic biology, SS, letter S like this, represent female. SY represent male. So the SSS chromosome in female, that is more than, we have one S. Yes. Male has 2 double S. So that double S has been found that has to carry to encode some immunological genes that also enhance the immune system to go into overdrive. Okay. So those are the 2 major reasons why female has more autoimmune disease than male. Okay. Although few autoimmune diseases can also be more common in male than female. For example, we have this called spondyloarthritis. More of autoimmune disease. It usually affects the back. We call it, the example is ankylosing spondylitis, and I don't want to go to big medical words.
No.
Those ones are more common in male, but generally, female has more autoimmune disease than male. Now, what are the characteristics of autoimmune disease? One, more common in female. Two, the other thing about it is that it tends to cluster in family. You understand this? You have what's a familiar tendency. So if a mother has lupus, the daughter may have rheumatoid arthritis. If a daughter has type 1 diabetes, the mother may have vitiligo, something like that. So yeah, it clusters in family. So when you diagnose autoimmune, you have to also
screen others
and ensure that you know that the family trees, and ensure that you pick some other ones, because the earlier you pick, the better it is. They say that about 10% of world populations are living with autoimmune disease. 10%? Yeah, that is more. That is quite like 700 million people or 800 million people. And then it's more, about 13% or 15% are seen in female, while about 7% or thereabout are seen in male. Yeah, that's showing that. So we also know that lifestyle like smoking, cigarette smoking, excessive alcohol intake, you know, even being obese has also been associated with autoimmune diseases. Not only infection, not only toxins, exposures, so cigarette smoking, excessive alcohol intake, and even excessive intake of inflammatory food, high calorie food, highly refined food has been linked with autoimmune diseases. Now, if you talk about how do they present,
very good. Now that you have it in the organ specific,
yes, because we have different categories, you know, organ specific. So the symptom the patient will have, we indicate that organs being affected. You understand? So we don't have general symptoms. For example, if autoimmune disease affect the pancreas, just like type 1 diabetes, so we know that pancreas produce insulin. So if the insulin is not enough in the body, you start peeing a lot, you start drinking a lot of water. Those are signs of excessive peeing, that urination, excessive taste, excessive even heart rate. So that is specific for diabetes anyway. If it is thyroid problem, maybe a thyroid can either be hyper, excessive thyroid function, or under activity of the thyroid. So if it is excessive, someone that have restlessness, excessive sweating, excessive heartbeat, you know, what they call that, there can be intolerance to heat. But if it is low thyroid, you gain weight a lot, the person is sluggish, the person can have constipation, the person can have cold intolerance. So the symptoms vary. If it is rheumatoid arthritis, swelling, painful joint swelling, usually on the fingers, prolonged morning joint stiffness when they wake up. If it's lupus, joint pain, sores in the mouth, sores in the throat, hair loss, skin rashes, you know, depending on if it is kidney, it attack. You know, people have swollen legs, swollen face, they pass foamy urine. Urine become foamy as they urinate all the time. So we can't really say, you know, general symptoms. Symptoms or presentation depends on the organ or the multiple organs that are affected. So that means that autoimmunity can affect any organs.
So how do we treat? How do we manage this case?
Now,
even a diagnosis.
Yes, so we use some laboratory tests to make diagnosis, because you know we say that antibodies are the proteins that are normally in our body, but however, when there's autoimmunity, they are secreted in large amounts and they tend to attack us. So this antibody can be tested in blood tests. Just to take blood sample of the patient and look. So each autoimmune condition has specific antibodies. And you that have to test for. Like in type 1 diabetes, you can ask for. When you hear anti means antibody. You can, so in type 1 you have anti-GAD, anti-insulin antibody. You know, in lupus now you have anti-double-stranded DNA, anti-SMID, different antibody. In Graves' disease you have some antibodies for them. So the doctor will just request for the antibody specific for particular autoimmune that you are suspecting, because you can't ask for all the antibodies.
Because that's quite expensive.
It's quite expensive, and it's even not cost effective, and also you are overusing the healthcare system. So you ask for antibody based on your clinical suspicion. That okay, this is one that is likely, and then you can also, it depends if it affects many organs. You can ask for tests to investigate that organs that is affected. But majorly you use antibody tests. Sometimes we also ask for genetic studies for some autoimmune to look for the genes. You know, sometimes for some specific autoimmune condition or autoinflammatory conditions. Now, how do we treat? Just like any other disease that is chronic, most autoimmune conditions are not curable. It's unfortunate, but they can be controlled. They can be kept in check.
Okay.
You can manage them. What I tell patients is that if you don't treat, then you are very unpredictable as well. You don't know what is next. You may be having vitiligo today, and you assume that vitiligo is nothing, and the same person 2 years later developed diabetes, type 1 diabetes, because they are related. But the same later the person develop a grave disease or develop any other autoimmune condition that is life-threatening. So we tell our patient that you have to treat you, and what we do most of the time, depending on the type, there are some drugs that are general, there are some drugs that are specific based on the cause.
Sure.
But majorly lifestyle is important in autoimmune disease, and just lifestyle for other disease like cardiovascular disease, reduce salt intake, reduce refined food, reduce carb, reduce calories, eat a lot of fibers, food that all those grainy food they help to regulate the immune system. Eat more vegetable fiber, oats, cereals, and whatever. Stop alcohol, stop cigarette smoking, reduce risky behavior, have healthy life generally. And if you need to be on medication, you start medication as early as possible and go for monitoring. Because we can't be talking about medication on social media or on online platforms. Definitely. But so the treatment depends on the cause and depends on the state, on the severity or the extent of disease. So all these considerations are what we look for before we initiate treatment based on the cause.
Thank you so much. I think we can go on and on and on, and we are always very grateful when we call on you. You are here to support us. And to our viewers out there, you've heard a lot about autoimmune disease. If you are black, you are a female, that means you are more likely to have an autoimmune disease. But again, it was also being heard here that we have autoimmune diseases that are organ specific. The commonest is type 1 diabetes in this climate, and multi-system, and the commonest is rheumatoid arthritis. But it's important that if you feel something, you know something, talk to your primary healthcare physician, who will do the basic thing before referring you to the likes of Dr. Hamid Olasebikan, because he's a consultant rheumatologist. We always say here, prevention is better than cure. Until next time, my name remains Dr. Mimuna Yusuf Kadri. Stay blessed.
Thank you very much, Dr. HAKEEM.
Yeah,
for
thank
being
you.
Our guest today.
Always
very
my pleasure.
enlightening and really very interesting. And I'm sure we'll still invite you again because you have a whole lot to let people know. And to our viewers, I just want to say thank you for keeping a date with us. One word here, lifestyle changes is very important. My name remains Dr. Martina Agbere. Remember to follow us on our social media platforms. If you want to be part of our program, just send us an email. Till next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.